With pleasure, would like to introduce our colleagues who today take part in this panel discussion. This is the Roman Sobko, anesthesiologist doctor, who started from the 2014 take part in the combat zone and has huge experience, especially in the anesthesiologist service. Next one, our guest. This is the Andriy Sobko, surgeon, since 2014 in the combat zone. Also has huge experience as a military surgeon and how to treat the current wound. And to our speakers, here's Dmytro Beshley, who is since 2014 also take part in the combat zone, has huge experience in the treatment of current wound trauma. Yeah. 66 hospital, which also attend to our panel. Welcome, Dmitry. Welcome and wish you all health. And Dmytro Samofalov, the surgeon, military surgeon, which now on the one of the our in the front line, I would not mention which one, military surgeon, also has a huge experience how to treat the current trauma. Dmytro, welcome. Good morning, everyone. Dear colleagues, I have a questions in the panel discussion to our speakers. It's about the experience, how to provide the help and support in the current modern trauma, and every speakers tell about their experience, and then we discuss and we will talk about the problem and challenges what they face with the current trauma. So welcome, Roman Sobko. Shortly, please. Please about your experience. Welcome, everyone, ladies and gentlemen. First, I would like to start how we start organization our work, how it was start, what we got when we start, what we had when we came to army. Before the war, we were the civilian doctors, so we provided civilian service, and unfortunately, all the experience we got during the war start. When we start, what we saw, that was a team, different people with a different background, different management, doctors from different facilities, civilian. The doctors who graduate from war academy, they had a different level of knowledge and skills, and we need to compound all this, bring to common and get the result. And we decide how we start. We start with the standards, provide the standards and training. We organized the trainings close to the front line. There was the course of the ultrasound, and I think it was a great step because we organized the speakers to city Pokrovsk, which currently now not a good time has, and also provide two trainings, couple days trainings about the protocols, how to provide the medical treatment, how they put the blockade, curettage, fast protocol, POCUS protocol, and that all for the that all the specialists who was with us, who worked with us, can get can came to some level. Because if you're not talking about the the people who came from civilian medicine, they had a different level of knowledge because all of them work in different facilities. Some of them work in the district, in county, where you don't have opportunity to learn how to provide such kind of care required to the time where we've been. It helps us to get one level of the knowledge, And then we can plan our job. Next step, what we faced, it was very problematic at the beginning of the war. The medical suppliers, for real, you can have a good knowledge, you know what to do, but if you don't have with what to do, this is the problem. In that way, I would like to thank and mention the organization Humana Illinois, that people provide us with all the consumers for 1 year ahead. So we used all this that they sent to us. It was very quality and nice consumers and devices that we can allow to work. And we work with that. It was very good. For that time, when the war was continuing, so we set up the logistics of military, especially if you're talking about medical aspects. And on the state level it also become more quality and the problem start to solve it. But one more time I want to emphasize at the beginning of the war also the volunteers and some organizations like Humana Illinois we could make a lot because that consumers were very important at that time. When we uh, when we make the staff who had the basic knowledges and good quality of the consumers equipments, and then we can start to think about the organization. What about organization? We think so the base was on the protocol ATLS. They was open for us and translated by Med Global. We took the protocols to adaptize a little, adaptize to our trauma, combat trauma. Then we start to get not bad result. The key, so it is the command work, teamwork, which we try to implement and still ongoing in military, because the cooperation between the doctor, anesthesiologist and surgeon, this is very important aspect, which can increase the chance of the save the life for the military wounded person. The standard ATLS. So all the specialists came through these standards, surgeons, trauma specialists, and we implement our standards required from our specialists to keep it. And all the specialists, surgeon or trauma doctor or anesthesiologist, had to keep it. So they should work due to that standards. If there is any problem, we had some meeting and discuss that. And if the doctor can explain us why he moved in another way, so it was with the argument, then we consider that. We accept it. And we can maybe it was the reason why we add something to that protocol in our hospital number 66. But the basic was the standard of ATLS. And that standard was very useful and very helpful. What about the improvement, the result? This is also important. This is about the unification of standards. If we're talking about stable points, stabilization or evacuation of the patients, we have to the equal devices. We have to have the same skills. We have to have same opportunity how to implement it. If we are keep the standards, following the standards, and do everything in the same way, then we will get the better result. Generally, key points I just covered, but if you talk more details, it takes more time. So I provide all the details. Mr. Andriy, please, about the surgeon work. Roman already covered about the work, about our activities. So every one of us came with from different way of the medicine, different type of the surgeons. Teamwork was very important. So we get create like ideal team who provide the example, and then everyone try to follow them. So everyone watch, observe, learn, and try to follow. That's why we say we have the positive result and save the life. Thank you. Dear colleagues, now I give the word to Dmytro Beshley. Mr. Dmytro, please, shortly, the experience of your work in the hospital, mobile hospital number 66, how to create such kind of efficient team who work in the teamwork way and provide a nice care for our
Дуже дякую за
soldiers.
можливість
Th-
виступити.
Thank you for being here.
Кілька певно складних моментів. Я хотів
Couple
сказати,
difficult moments.
щоб певно наголосити
I would
на
like to
плюсах
emphasize about
позитивних
the
багато запевнених, але
advantages of
певно
that,
також висвітлити і
and
деякі
also
негативні
talk
моменти,
about
які потребують висвітлення, якщо ми
disadvantages.
хочемо виграти
If we
у цій
want
війні, і
to
також
win in that
зберегти велику
war,
кількість
we need to talk
записаних наших громадян за цей
also
важкий
about
досвід.
we need to provide all these people to
Коротко,
the same
насамперед, це
standards.
має бути
First
добра мотивація.
should be good
Особисто
motivation.
моя думка, люди,
My
які прийшли в
personal opinion.
22-му році, які
The
раніше
people
були
who come in
дипломатами в
year
20-му році, були
2022 and
високо мотивовані.
2014, they were
На
very,
думку
very
батьків
motivated.
також
I would like to
розуміння, правильне
understanding
розуміння медичних знань.
the understanding of
Наприклад,
medicine
стосовно
terms.
себе. Чи вважаю я себе станом на зараз військовим хірургом? Так,
Can I
вважаю, я
call
є
myself
мобілізований
now the
військовим хірургом.
military surgeon? Yes, I
Чи є я
can.
станом на зараз професійним
And I
військовим
am now the
хірургом?
professional surgeon
Бо я є
military.
мобілізований військовий
No,
хірург.
because I was
Станом на
mobilized.
сьогодні я є церковним
Currently,
священником
I'm
залишаюся.
the heart
І
surgeon,
відповідно я би
vascular
хотів, щоб
surgeon.
ми всі розуміли різницю
So we
між
should
ними.
difference between
Друга
the
річ.
like civilian and professional
Рівні
military.
медицини,
The
які
level of medicine
намагалися принести
which tried to
мобілізовані
bring
лікарі,
the
мобілізовані
doctors,
лікарі у
civilian doctors tried
військовий
to bring to
фронт.
military
Це перш
as
за все
field.
ті стандарти допомоги,
That was the
які ми
standards of
надаємо
the
в своєму
help
щоденному
what
принципі,
we provide
і
in our
які ми
routine
максимально
service, and we
намагалися
try to
втілити в життя у
maximize
складних бойових
to
ситуаціях,
implement
які
in
ми
the
були.
combat
І, власне, про ті
aspects.
принципи доказової медицини, про які казав
And I
Роман,
would like to take what
далі.
about the Roman said about this
Друга
medicine.
річ
Second
принцип
one
командної роботи.
about the principle of
Перш за
teamwork.
все, для нас це
First of
був,
all,
звичайно, виклик і
it was a
залишається
challenge
виклик.
for us and
Як
still
при
ongoing
обмеженому
challenge
ресурсі, тобто
because
на
we have
одній
the lack
кількості
of
людей, медичного
resources. We don't
персоналу,
have enough
при
people,
великому
medical
потоку
people,
пацієнтів,
and
тобто
a
великій
lot of
кількості пацієнтів, це
massive
велика кількість
arriving
завдань.
of the patients.
Правильно
How
діагностувати,
to right put the
правильно
diagnose
лікувати, надавати
in the right
первинну
way to
медичну допомогу
treat,
без
provide the
гіпердіагностики
right care
і без
without hyper
гіперлікувальних
hyper
втручань,
treatment
для того,
injuries
щоб максимально ефективно розподілити
interventions.
сили
Try to
і зменшити
maximize and
той
use the
досвід ускладнень,
optimistic you have and
який ми
according
можемо
to
нанести пацієнту, правда?
complexion
І
we
який
have.
час мають складні
S-
поранення. Третя річ
Third,
це власне обладнання і
the
методи.
equipment and methods.
Я певно не відкрию
I
секрет, що
think I don't
багато
open the secret that a
багато власне
lot
методик
of
в
methods
Україні
in
базовані
Ukraine
військових мобільних госпіталів.
start from
І
the mobile
це люди,
military
які сидять в
hospitals.
панелі 100% можуть
And
підтвердити.
these people who now
Зокрема,
sitting on the
наприклад,
panel, they can
застосування першого
approve this.
покоління підводення інфузора,
So
який до
the
того навіть
implement of
великий
first
центр травми
refuser.
не був використовується. А
So
це є один з
this
приладів,
is the one of
який,
the equipment
власне,
which we
дало
have to
можливість врятувати десятки
use,
і
and it
сотні
save
життів. І
10
також
or
завдяки
hundreds of
нашим
lives.
міжнародним партнерам, які
And
дозволили нам
thank you
цей
for our
прилад
international partners
відповідно
who
нам
provide
його
this
реалізувати і
equipment to
концентрувати
our
увагу.
and make it more and more.
Далі застосування принципів доказової медицини.
And then how to evidence of
Принципів
medicine,
доказової медицини
medicine evidence.
це те, що власне наголошував Роман.
This what the Roman
Тільки
was emphasizing, that
якісна медицина
quality medicine
дає можливість врятувати
provide
якомога більше життів,
help us to save
практичне
as much
приклади
life as
лікування,
possible.
особливо в такий складний час,
And
коли
the
війна
practical
триває довго.
approach,
Коли
it's
наша
also we
мотивація
should
менша,
consider
і
how
постійно
long the war
говорити
is
ті
still
тренди,
going
які
on.
є, певно, на сьогодні постійні. Війна щораз ближче стає до нас.
So you see the
Наша
war is
країна
coming
щодень
close and
зменшується,
close to the
фізично
civilian
точно
people.
зменшується.
So the
І друга річ
and
це
second one,
країна бідніша.
we becoming the poorer.
Тобто кожен день наша країна
Every
бідніша.
country,
І ми
our
повинні
country
правильно
become
реалізувати
poor,
наші кошти,
and we
спрямовані
should
ці
react
можливості
on that. So it's according to our fund, our money. So we should use in the right way the money that we have. And most important, and the challenge that we have, the challenge we have now on to 2024. For example, if we count the numbers of the medical military medical, if we compare 2022 2024, can we ask, is it increase the numbers or it's decrease? You can ask how many military medics now in the front line and how long, how often we make the rotation, how often we involve the another medics. I think the colleagues and I think the colleagues who sit in with me and I honor cooperate with them, they agree there is a big hole between the civilian and military medicine, especially especially about the doctors who during these 2.5 years still in civilian medicine, and those doctors who partially dedicate their time to defend their country and provide help for military patients. Also, there is understanding the difference between the civilian medics and who was the attract to medicine, because some of them still progress in their career, and one who been involved on the military line, and they see on the life from another point. And this question what we have for during 2.5 years of full scale and still not resolved. There is steps. There is some steps still not resolved. Some problems. For example, such kind of difficulties. First of all, I would like to the question of motivation, and the second, this is also the question of the professional responsibility. I think my colleague they will agree with me. It's about the responsibility in the military medicine and the civilian medicine. It's related. We don't have we don't have a lot of opportunity to be responsible for our mistakes. We only can make analyze using our honest and doing this way self-improvement. That's a question I would like that we discuss, that will help us to move on and make more progress and bring more positive for our medicine. Thank you, Dmytro. Dear colleagues, I give the words to Dmytro Samofalov. Dmytro, please shortly characterize your experience and the challenges you faced. Very short. Generally, all the things were covered. Only what I can say from my experience. Couple years before the mobilization, I worked different level of the management in the Ministry of Health, the organization of Ministry of Health. I work at the night shift in the emergency department. We organize such kind of trainings in different ways. First of all, I would like to say when we organized our our approach to examine the patient, I can say that it's a pure ATLS. Because if we're talking about the emergency medicine or another type of medicine, because some of them pass the trainings, TCC, trainings of different PHTLS, there are some differences in that. And when we organized our job according to what we had, so we based on TCC and ITLS. We based on that. Some aspects of that I like it. I don't want to talk about this so much. And adding to all I said, what was very important for me, because inside I was very happy that there was the Ukrainian statement on the law level who like legislate some kind of make, for example, how to react on hemorrhagical shock, that we can palpation on the street. The statement about the surgeon on the stage of the evacuation, how to do all the damage control, about antibiotics. Because if we back to experience, when we talk about, I took care about the trauma around 15 years, surgeon in the hospital. So I also the orthopedic doctor. A lot of was interested in trauma. So, but it was built inside the department where I work. Now you should build there on the stage of the, like I should build their level. What I do when they come to me. What do they do when they go in there? So we realized that some of the approach was very very old school. So we had some discussion. So we create some rules and approaches, and this is very important in the when we're talking about exact phases of the provider help for the military. First of all, we should think about the phases. We should think what's gonna be after they will leave our point, because we should think what they're gonna be on the next phase. We should do everything then on the next level for them. They will clever and easier to provide the help. That's why we talk about what to do inside your team to approach the algorithm. Uh, Different approach, how you use the equipment you have. Very very important was to training and understand the stage of your evacuation stage. We had the issue when my group was transferred, and we've been on the different another way of the evacuation. And after evacuate the patient after the damage control, which was very clear for us, on the we received the like defectura, so there was some kind of defect because we haven't been on our phase, on our stage, which was new for us. So because the people who did who work after us, they didn't understood what we did on our phase, because this phase was new for us. So this is important to work in the same phase on the different. Thank you, Dmytro. Please tell. Dmytro Beshley raised the question about motivation. Now you're preparing the surgeon group. Tell me, please, what the problem you have in the process of formatting this group, how you can improve this motivation for the military medics. So how we can improve this mobilization for mobilization doctors. So motivation question, first of all, for civilian, even the doctors, is very hard. People doesn't want to go. Had conversation, I was looking, tried to commit them. They said no, we don't wanna because of the motivation. I don't know if it's exactly about the motivation, but that's what I faced. This is the question. Basic trainings, basic preparation, especially it's about female. If you start to talk and you said, okay, let's see, we are the surgeon department, let's do this, because this not going to the stage of the military point. So you try to explain them that this is all the faces should cover, but they're not ready for that. And I think about this. Should we really train our nurses, medical nurses, to do some job that we have to do? Like, for example, to work in the trenches, or we need make something new, or where they can cover the TCC. So some skills that more close to them. I'm not sure that I'm right, but what I see for myself in formatting group, it's not about the motivation, it's about. And second, here's funny story. We know everything about stabilization points. There is a lot of stories in internet about this. But no one has know what means to work in the front line like surgeon. And when I go to start to talk with the doctors, medical doctors, and the felchers start to say them some histories. Let's go to this department. And there's some of them who work in the civilian area ask me, what is that? What we should do on the front line? You should explain them so that this is the same like stabilization points, but it's with the expand power. Maybe we need to more explain about that for civilian doctors. What the stabilization point, what is the front line work. The society should understand the stabilization points they understand, but what is closer to the front line they have no idea what's going on there. They don't know what's the responsibility. So what they think, the stabilization point and that's it, and then everything will cover that. They do not realize there after that there is a lot of phases, different work which we they have to work. I think we need more widely cover all the work of the medical chain. If we're talking about from the people should understand that every doctor on every stage, every nurse, every fellow is very important on every stage, and it helps them to provide the help. Thank you, Dmytro. Dear, dear everyone, please engage you to. If you have a questions, please come and make the questions to our speakers. Be more active. Next question. I would like to ask to Roman Sobko. Roman, please tell if compared 2014 and nowadays, is there any positive progress in the anesthesiology group work? Thank you for question. Sure, there is some progress. It's unfair to not admit the level of providing the care and the supplement of the treatment process of the military now is more higher. If I remember 2014, it was I think in that chain where we work with Andriy. So with Andriy, as I can say, there was the hard situation, especially with the Donetsk airport. If you know this story, that was the most intensive the fights. Who was in Donetsk airport? So we can make the parallel with the like Mariupol fight. What was in the Azovstal? So almost close the same was in 2014 Donetsk airport. All that patients came for the stage of the evacuation, who was in the city of Selidovo. I don't know if we still it still stands on, but very often the missiles, the enemy attack this, and we provide the help to all the patients who came out from the Donetsk airport because this city was on the way, on the evacuation way, and we work there. Of course, the level that was then, for example, about so we at that time we just came from civilian medicine and want to admit me myself Andriy and Dmytro, we work in civilian medicine in very powerful very good hospitals which due to where the doctor used to work. If you want to work there, you have to have a huge skills and huge, and you know what to do. And the war, when the war started 2014, we came to the military. We were sure we can do everything. We can everything. But when the massive triage started, when the massive arriving started, there was thoracoabdominal trauma. We realized that all the knowledge that we had before, it's not enough. And we started to improve it and develop ourselves. And we were sure that now we know everything. But in real life, 2022 show that there is no the borderline of the development of the learning, get the knowledge. There is no line for the get the knowledge. this war if compared with the 2014 current one, more bloody, more scale, and more complex war if compared with 2014, because then in real we didn't see so much patience per one day. For example, our department can took 150 injuries. That now in 2014 we don't have such kind of scale. That was the challenge for us, and we try to how to set it up, fix it, and we try to find something new way to how provide the quality help. Thank you. Andriy, please tell us about your experience. How is the important the teamwork? Is it important teamwork? Colleagues, we have the alert. Alert. Please question the organization. We should go outside. We should go to shelter. They will provide the information. Andrei, please tell us. Is it important that teamwork, that brigade can be can make from the group of the people who, like the anesthesiologists, who or the team can formate or the team can formate before they join the brigade or platoon. In the military medicine, if you're talking about how to work the teamwork, this sounds very great, but in real life it's not so good. We also emphasize on every opportunity if the teamwork, when the teamwork give the result. Teamwork, it's not only communication, the surgeon and the anesthesiologist. It's also the common interests. The same motivation should be same motivation. Only then it will work like teamwork. Or just if you collect the people from different countries and tell them, please find make sense, it will not work. And there will be the critical moment when they uh, can work self-organized. Only where they should some based that unit them. Yes, and there should be a leader who can formate this brigade, who formate them according to professional skills, psychological skills. Thank you. Dmytro Bushlai question about psycho-emotional problem. Is there any problem with the psycho-emotional? What do you think if there is problem and how to fight with that? Thank you for question. I would like to tell you about that.
Суддів року судить Роман Андрійченко. І от
There is an
що, наприклад, безпосередньо мотивує мене? На першому місці моєї мотивації після, якщо ми говоримо за
What motivates me, according to this is my wife and my daughter, who are very positive, and that's my sense of my life, and that's my motion force. These are the people who support me morally, and let me show you something now, if you can see that. That's how the system should be working and how I would change it. So here I'm amongst the room, the operation room, which was repaired by Roman Sobko, and I hope you see the equipment, like the infuser, artificial ventilation, infusomark, and that's a well-equipped room, and all this is in the cellar, and this is the system that works due to Roman Sobko efforts and his good trace, and it's still working. I know Roman is in Kiev, but what he has implemented is working right now, and that's a great motivation for me. The other thing, Sobko has always emphasized the good quality.
І перед вами є товстий акт.
So here you have this row, because due to this man we found out what is Legoshuria and how to use that correctly in our surgery, and that works. So as a motivationally, my thinking is what Andriy will tell me about it, and it would be good to keep up with him. So that's my personal motivation.
Тобто, що би я зробив на
So what would I do? I would
що
show
можна працювати в таких умовах.
that a person can work in such conditions, retaining quality, achieving good results.
І якщо люди лишають після себе
And if the
позитивні
person
речі,
leaves such positive traces, that really works. And what I would change as in a system,
як можна
I would take a look how to impact
реалізувати позитивну ситуацію
and implement a positive situation in a certain situation and then scale it up, because this motivates the others. So, as I say, a lot of people who were here in 2014 and who come here in 2022 have different motivation.
відповідно. Ми маємо
In this
сказати,
regard,
так само, як
I must
у
say
будь-якому
that
бійцю, так
just
само, як
like
і
in
в
your
військовій.
like in military, you need to say this to Ukrainian doctor that as of now, this Ukraine is the state for a military, and the state is us, and our duty is to provide qualitative support and qualitative conditions. This is our duty, so please help us. And the Ukrainian soldiers will be highly motivated and in a bigger number, and the result of our work will be more efficient, and Ukraine will stay. What about the burnout? Yes, there is a burnout, but my motivation is my colleagues and my family, my colleagues who are trying to walk all the way down to the victory. Thank you. Dear colleagues, you have seen a practical example where Dmytro Beshley have shown an existing operational room. That's one of the complicated directions near Pokrovsk where Dmytro conducts his service. And you've seen a modern equipment, so everything is available to support our wounded. Thank you, Dmytro. And there is a good saying, what you have saved, you have transferred. So you can see that one colleagues have created and the others have transferred the experience and the equipment for our colleagues. Thank you, Dmytro. A question to Dmytro Samofalov. What about the implementation of international standards and modern conditions of the war in Ukraine? How do we implement these international protocols in providing assistance in Ukraine? As I touched upon it, first of all, we have, well, I'm lucky to have such great people who are highly motivated to make themselves perfect, who wants to read and get to know new protocols. That's a first part of this component. As for me, the second component is legal support from the state. I mean, new orders and new legislative acts that, to be frankful, are the translation of international protocols that were approved by appropriate ministries in Ukraine. And this is perfect for me, because right now we have a chance to do our work officially in accordance with international standards. For some people, just like some people in my life, it was quite a justification. Why do we need to do this way, not the other? Because previously I used to do it different. But if there is an order, I'm following the order. Because previously it was like, I don't have an order, so I'll do it this way, and this was quite a serious factor. What is also interesting, that we're implementing the protocols and we're developing them all at the same time. I can't say if we're getting it better or not, but by implementing Ukrainian realities into international protocols, we're rethinking them. That concerns all the laparoscopy, for example, at different stages. And I think this is very important because we just didn't take the protocol and follow it. We took the protocol, we understood it, we implemented it in this situation, and we adapted it. We're not creating something, but we're using the same elements, making them more adaptive to the situation. Thank you. Maybe you have questions to our speakers. Please, you're welcome to join and be active. Well, Mr. Dmytro Beshley and Dmytro Samofalov, thank you for joining our discussion. Take care. Thank you. And dear colleagues, I want to thank our speakers, Andriy and Roman Sobko, for their experience they shared and preserved and transferred further. So thank you. This panel is over. Thank you.